Doctors of Reddit. What was a symptom a patient didn't mention that was really important? Story 1. I had a guy come to the hospital who told me he had seizures every Tuesday like clockwork. This is highly unusual for somebody with a seizure disorder. It wasn't until I asked him about his social history that he told me he's a heavy drinker. I investigated further, and it turns out he binge drinks Thursday, Friday, Saturday every week, then stops cold turkey. He was having withdrawal seizures. Story 2. I'm a med student, and on my family medicine rotation I was sent to see this woman before the doctor and get a history and physical. She was saying she was having heartburn and just wanted us to give her something to throw up, so she will feel better. I thought it was odd, and so I went through some more review questions, and she said her reflux pain was extending up to the left side of her neck and down her left arm, and that she had been sweating for hours. I cut off the interview short there and went to my teaching doctor to tell him everything and what I thought. Got an EKG. Yeah, she was having a heart attack, had to call an ambulance and get her to the ER. Story 3. Chest pain. Guy denied ever having chest pain. Ever. Told us he was able to chop and work on his land without any issues. He didn't meet any criteria for additional workup prior to surgery. During his major surgery, he had a huge heart attack. A cardiac cath showed that he basically had one very narrow coronary artery that was the only thing getting blood to his heart. His daughters, who were nurses, all swore up and down that he was healthy as a horse and never complained of heart issues. Then his black sheep other daughter arrived and said he actually had told her that he had terrible exertional chest pain every time he did anything, but that he didn't want his other daughters to know because they would worry. He died a few days later. If we had known about his symptoms, he would have likely had his cardiac disease diagnosed and treated prior to surgery. Edited for typos, was on mobile during a break at work and didn't notice them until now. Edit 2. Since this post is getting a lot of attention, here is an informative article about chest pain from the Mayo Clinic. It's important to note that women and people with diabetes may not have the classic symptoms of cardiac chest pain. The American Heart Association summarizes some of these differences here. Edit 3. Thanks for the coins. And I'm sorry, but I can't give medical advice over the internet. If you are concerned about symptoms you or a loved one may be having, go to a doctor, please. Story 4. Saw a patient during follow-up for a gynecological cancer. She said she felt great. Exam was normal. She was relieved, but she was so anxious it set of my medical spider sense, so to speak. I decided to push a bit further, which led to this conversation. Me. So you said you felt good? Absolutely nothing else bothering you? Her. Oh, some small things. Nothing having anything to do with this. Me. Well, why don't you tell me anyway? Her. Well, I kind of have this weird lump on my belly, a sweat gland or a greasy nodule or something. Doesn't really bother me, but I might get a dermatologist to have a look at it if it ever needs to be removed. Me. Ah, I see. Could you show it to me? She showed me, and I saw a skin metastasis. Clear as day. Don't know how the story ended because I moved to different service immediately after, but if I had to guess, her life expectancy was probably measured in months. Story 5. I'm a doctor. These stories are from a few years ago when I saw patients. I'm a medical intern, working the ED. Dude comes in with a heart attack. That part's clear as day. Gonna be medically managed, procedure in the morning. I'm about to queue up some nitro paste. It's a cream you put on skin that helps get blood flow to the heart, as my resident had seen him first and said it was okay, and I went through the contraindications as it was just habit at this point. One of them is recent Viagra use. Patient had said no to recent Viagra to my resident when his wife was there. He said yes to me when I asked when his wife wasn't there. He wasn't using it with his wife. Nitro paste was avoided. Blood pressure stayed okay. Coronary got stented in the morning. Discharged the next day. Pro tip. While you toss the family out to do the rectal exam, ask all the questions they won't answer honestly. Story 6. Not a people doctor, but I worked as a vet tech for 3 years. Had a little tiny mini Shih Tzu in horrible health with a nasty attitude to match. You could seriously barely touch the dog and she was very sick. The only reason we were able to do anything for her was because she was so small. Owner comes to visit her one afternoon and casually mentions to us that she's deaf. Poor thing was scared out of her mind and did remarkably better once we learned to let her know we were there before touching her. Story 7. Black stools. Folks, if you're having black poops, F's mention that sooner rather than later. That lady has been seeing nothing but black for months before she thought to mention anything. We found several gastric ulcers and a hemoglobin level that circled the drain. Edit. After reading through some of these comments, I have a PSA. If your doctor doesn't properly listen to your concerns, ask for a second opinion. I wish we all could take good doctors for granted, but that's just not how the healthcare cookie crumbles. As both a physician and a patient, My heart goes out to all who have had to battle both their disease and provider. It isn't fair and it isn't just, but remember that you are still your best advocate. Edit 2. And now I can add Oreos to my list of causes for black poops. Sweet Jesus on a skateboard, folks. There is some stuff here you won't find in any medical textbook. Story 8. I'm a doctor. Back in school, I had a patient who was a drinker. Wasn't feeling great and wasn't sleeping well lately. Asked him how the drinking issue was going, and he said he lost the taste for it. Alcoholics can quit. They can stop. But they don't just lose the taste for it. Cancer. Story 9. Medical intern here had a woman come to ER complaining about stomach pain, took her full history, did the exam and vitals. She seemed fine, mild fever. Made a preliminary diagnosis of gastroenteritis and presented to my doctor. My doctor, who is female, goes to her and asks why she came to ER for something so mild. She says because she noticed blood in her stool. The doc comes out and asks me if I asked about her stool. I did. She said it was fine, and I asked specifically about blood. She goes back in and asks the patient why she didn't mention that to me. Her response, didn't think it was appropriate to say it to a male intern. Turns out she had ulcerative colitis, needed a colonoscopy and long-term medical therapy and possibly surgery. Story 10. If you are a middle-aged plus gentleman and you have cardiac risk factors, diabetes, overweight, etc., and you develop erectile dysfunction, you should tell your doctor, as there is some evidence that it is an early symptom of heart disease, possibly preceding a heart attack or stroke by 3 to 5 years. Far better to get on statins and blood pressure medication than just ignoring it, or taking Viagra by yourself. You can tell if it's a circulatory cause, as opposed to psychological, if you stop getting morning erections and have difficult achieving an erection in your alone fun time. A GP told me this during my primary care rotation. Med student here. I assume she told me this for my learning and not that she thought I was likely an impotent chubby dude. Edit. Thanks to all the kind people who said this was useful, eye-opening to them, and also thanks for the gold. But to other replies asking for medical advice, I'm not a doctor. And even when I do qualify, it's not really appropriate for me to be advising or diagnosing people over a few lines of text on the internet, so I'll have to apologize, but stop asking. This is just a general PSA if you like, but see your own doctor if you're worried, not least to get willy issues sorted, which are no fun for anyone. Story 11. As a primary care doctor, we try to keep to our tight schedules. It can be difficult when patients could come in with something complex or with a shopping list of things they want to talk about, and balancing this with providing good care and being mindful that the next patient will be waiting in 15 minutes for their appointment. We can be notorious for being late for these reasons. I saw a patient the other day who said she had a runny nose. I just got on with it, made sure she didn't have any signs of a more serious illness, and gave her some advice on what to do. After that, she also had a pain in her ankle she quickly wanted checked out. I couldn't find much wrong and assured her it would probably be okay in a couple of days. Now her 15 minutes is up and I'm kinda gesturing her that we are finished. Then she pauses and says, okay, I just wanted to get those things checked out. The main reason I'm here is that I've been having chest pain all morning. God, I facepalmed. Story 12. Always. Damn. Unintentional. Weight loss. Takes me from okay, not too bad, to oh. Edit. Unintentional weight loss is losing more than 5% of your usual body weight in 6 to 12 months. Your doctor should work through the possibilities step by step, starting with most common to least common. A CT scan is usually not the right first or second answer. You should be getting age-appropriate cancer screening, PAPs, colonoscopy, mammo, testicular exam, prostate exam, and bring a detailed family history of cancer to your doc, including type of cancer, when it was diagnosed, and what stage it was diagnosed in. Make a diary of your symptoms, including things like night sweats, mood changes, diet, swollen glands, blood, or changes in stool, etc. Story 13. Not a doctor, but I'd been working with a doctor about getting back on antidepressants. I mentioned my upswings, where my depression was gone. I was super productive. I didn't feel hungry. I could stay awake for days without being tired, and I had endless energy. And turns out I'm not depressed. I'm bipolar. I've been experiencing some form of mania. Story 14. Admitted a baby. My intern year that had transferred to our facility for persistent vomiting following a surgery on a part of the intestinal tract. The transferring facility had wanted us to start the baby on a form of intravenous nutrition and offhandedly mentioned some low-grade laboratory abnormalities that they had attributed to the baby just having had surgery. I go into the room in the middle of the night, the first representative of our medical team to meet the family, and in the process of gathering the history, ask the family what color the baby's was. The family replied that it was white or gray and had been since birth, and that they just thought that was how it should be. Record scratch. Big red flag. We ultimately diagnosed the baby with a rare genetic disorder that required an organ transplant. Edit. Thanks for the engaging discussion, everyone. To address some recurring themes, no, it was not biliary atresia, though that should be at the top of the list in anyone's mind when a baby has a colic stools, since the chances of success of the surgical correction of biliary atresia decrease the older a baby is. As for pediatric liver transplant, I am by no means an expert, but the donor pool is typically the same. They just harvest a smaller portion of the liver so that they aren't putting a huge organ into a tiny baby. And as for outcome, I've kept up with this family, if only peripherally, over the years, and the child is doing well. I'm reasonably well past my residency training, and this was early on in my first year of training. Story 15. I had a patient who needed a small sterile procedure done, but had a latex allergy, and it was in bright red all over her chart. We used paper charts back then. We had just ran out of latex-free sterile gloves. I went in to tell her she needed to come back in a week when we got them back. Then I decided to ask what happened when she came in contact with latex. Her response, I get chlamydia. Story 16. Not a doctor, but I ended up in the ER due to my heart begging to race while I was not doing anything active. I go over everything that's been going on. They run a few tests that all come back normal except for my LFT, liver function test. They ask about how long I've been tired and struggling. Since I have a chronic illness, I just tend to mark it as that. Nope. Drug-induced hepatitis. Was taken off all my meds to find the culprit. Acetaminophen was slowly killing my liver and could have led to much worse consequences. Story 17. I had a patient whose main complaint was a wrist sprain. Asked how he fell, and he said he felt lightheaded and fell down the stairs. After about 15 minutes of questions about his heart and other stuff, I asked him if he's had any vomiting. He said he vomits every day. I asked if it's red, and he said it's bright red every time. The kicker is this was his usual yearly appointment. Dude was vomiting blood every day and not only did not go to the ER, he didn't feel it was worth mentioning at his checkup. Story 18. I once was rounding on a patient in the morning that had come in for a stroke. I decided to ask some basic review of systems questions just out of habit, and when I asked about changes in vision, he said yes. I probed further and he told me that he was using eye drops for something, but that he forgot his eye drops at home 3 days ago when he came to the hospital. For the last 3 days, the vision in his left eye was worsening along with eye pain or pressure. When I call his pharmacy to see what drops he was using, as I suspected, they were for glaucoma, and he was having worsening vision loss due to untreated glaucoma increasing his intraocular pressure. We got an ophthalmology consult stat. Story 19 did my sub-eye in a level 1 trauma ED a few years ago as a 4th-year med student. Homeless guy with Hep B, Hep C, and HIV came in talking about a rash on his shoulder, how it hurt. Had been pretty hot out, and that was where he was slinging his bag on. Looked okay? Figured it for a sweat rash? He was really in there for food. So was going to give him some cream and a sandwich and send him out the door. Was about to leave when I looked at his chief complaint again, and it also had testicular pain. So I asked him what was going on with his testicles. Lifts up the gown, and he has a tracking abscess through his scrotal skin and through one of his testicles. It was like a worm burrowing through his like it was an apple. Oh, it's okay, I guess. Ended up calling urology and infectious disease, and the guy ended up leaving against medical advice because we were making him NPO, without food, in anticipation of surgery. Edit. Clarified part of story. Story 20. My doctor forgot to look at my chart and did a test. I went back after the test and she said, "You need to be on X medication," and I told her I was already on it. She was shocked, and it changed my diagnosis because it should have improved, treated me, and didn't. Edit. A word. Story 21. Not a doctor, but something I hadn't considered would be an issue. I had shortness of breath and chalked it up to a somewhat rare condition called hemolytic anemia that I'd had before, but had been corrected with heavy doses of prednisone. I called my GP and he scheduled a lab, but my levels came back normal. It kept getting worse, so I finally went to the doctor. They did a chest x-ray and said it looked like I had 2-lobe pneumonia, which was rare for someone my age. At this point, there were probably 3 doctors in the room asking questions, including my own. My doctor then said that because I have lupus, I'm at risk of developing blood clots, and wanted to know if I'd experienced any unexplained swelling. Well, yes, actually. My right leg below the knee had been slightly swollen for weeks. Turned out I'd had a pulmonary embolism and was lucky to be alive. Also, my doctor is a genius and is definitely the reason I'm still alive. Story 22. Not a doctor, but my grandfather works in radiology. So he x-rayed some women's breasts and found 2 giant blobs of white that looked like cancer on the screening. He did a side screening and found it in the breasts. My grandfather showed it to the patient and she said it was her breast implants. Story 23. I'm an X-ray tech, working in the ER one night and go to get a patient from triage for a chest X-ray. Patient has already been triaged, including IV started and labs drawn. Finish the exam, and on the way to take the patient to a room, he turns to me and says, "Can you tell the nurse up front that I have HIV?" I forgot to tell her. Yeah, I can see how something minor like that could slip your mind. Story 24. Had a guy who was sent in because his family was concerned about him, because he was getting into a lot of physical altercations. Appointment with the patient was normal. He was able to talk himself out of most issues his family stated were occurring. And as we were ending, he said he had to pick up his other truck from the shop. I then asked, "Oh, you own 2 trucks?" He replied, "I own 5 trucks." The guy was military and only made 60–70K a year. Come to find out he had bipolar disorder, and in his manic episodes he would take out a large loan to buy a new truck. He had almost 120K in debt in just trucks. If it wasn't for that last part of him mentioning he was getting his truck, I would have sent him home and probably never known he had a psychiatric issue. Story 25. Medic here. Ran a call to a general sick person call and arrived to find a slender lady in her 80s. She wasn't feeling well and her granddaughter finally called 911. We run through our assessment and aren't finding too much to go on. And then me. Anything happen recently? Like a fall or a trip or something like that? Her. Well, I fell a few days ago and hit my head, but I wasn't feeling bad until a couple hours ago. Me. Oh, okay. And you took all your meds since the fall? Her. Well, no, I didn't take them yesterday. Just today. Me. This morning like usual? Her. Well, no, I took them about 2 hours ago. Screech sound. Me. Including the blood thinner? Oh, snikes. Yelled to the other FFs to grab the gurney. I didn't even need her to answer. I knew exactly what was happening. The second she told me she took her meds right before she started feeling off. Subdural bleed. Didn't even matter how fast we drove. And we drove fast. She lost consciousness shortly after we got to the ER and probably never regained it. The blood thinner accelerated the bleed and she expired from it. It was such a terrible situation. Her granddaughter was really confused and scared at the sudden shift in our demeanor. It was such a large bleed and textbook case presentation that it was used as a case study for our quality improvement training. Story 26. 16-0 came in with blood pressure of 60/30, pale as a ghost. Tons of free fluid in his abdomen on ultrasound. Turned out he had metastatic testicular cancer that had eroded into his aorta and was bleeding into his belly. Come to find out later he had testicle lumps and was too scared to tell anyone. Edit. For those asking, we resuscitated him with blood and fluids and transferred him to the nearest PEDS ICU. He was treated, lived a few months and passed away. It was incredibly sad. I think of him often. Story 27. If you have unintentional weight changes, especially weight loss, go see the doctor. If you have sustained changes in appetite and energy, go see the doctor. If you are a diabetic, regularly follow up with your doctor. Source: 4th-year med student. Story 28. Not a doctor and not even about me, but this is just too interesting of a story for me not to post it here. So, my dad was a bit of a slow child. Always forgetful, got bad grades, needed to have a list of everything important with him all the time to avoid forgetting it. In his 20s, he gets an allergy test done for no real particular reason beyond having it recommended to him by his doctor. Turns out he's lactose intolerant. Of course, he tells the doc that the test clearly failed because he's never had a bad reaction to milk in his life. Are you forgetful? Turns out that lactose just makes him forgetful. The doctor he'd visited happened to have done research specifically into that type of lactose intolerance. He cut dairy from his diet and suddenly all the problems went away. To this day, I've never met anyone else that even knows that this can happen. Story 29. Not a doctor, but this happened to me. I had to see the doctor to discuss some test, so spent some time talking about that. And as I got up to go, I remembered a message that the optician had said to tell the doctor about a mark on my eye. And the doctor got very serious and said, "That's really important." And then we discussed the implications of that, but I thought it was something really minor. Story 30. So triage nurse doing phone triage. Member had high BP 180/90 due to not taking BP pills. This was not outside her unmedicated baseline. I asked if she was having shortness of breath or chest pain. She said no. Booked her a same-day apt after talking with her provider. Was having a heart attack with both chest pain and breathing issues when she came to her apt. Don't lie people seriously. Had to call an ambulance. Story 31. If a woman comes in and has had an accident in the home, check for skull swelling. I once went to hospital with a shattered elbow. I had been unconscious for a couple of hours with complete amnesia and no memory of the assault other than him grappling me. Long history of DV and arrests. I had a huge contusion on the side of my head. hidden by my hair, but was too scared to say anything. He told me I fell over the dog, so that's what I told the doctors. Edit. I know full well he punched me in the head, had done it many times, and also regularly twisted the same arm behind my back. Don't take everything at face value. Story 32. I'm not a doctor. My dad was cooking and sweating and was getting out of breath around 6 p.m. He was 50 years old. We ate dinner and went to bed. He stayed up all night with chest pain because he didn't want to wake my mom up. He finally decides to wake her up at 4 a.m. She's a nurse. She calls an ambulance because she knows the signs. The paramedics get there and do an EKG. My dad is laughing and goofing off with the firefighters. My dad refuses the ambulance since he was no longer actively having a heart attack. He took a shower, got a cup of coffee, and around 7 a.m., my mom finally gets him to the ER on the threat of divorce. He was immediately taken to the cath lab and died twice. I didn't find out until 11. He was just getting out of surgery. His surgeon, Dr. N's first words to me was, "He is okay, but I've never been more scared." He mentioned that he almost himself. He's still my favorite person on this planet, and Dr. N's dad is now my dad's primary doc. My dad now carries nitro. If someone is having a heart attack, you should call 911 and then check their key set for medicine container. Nitro can save a life. Story 33. Slightly off topic, but working the back of an ambulance rig riding with a 45 YOF patient who had slipped and smacked her head on a washing machine, she tells me as we pull up to the hospital that she had a previous event when she was 19, where she fell off the back of a pickup truck when parked and hit her head, went unconscious, and started seizing. She coded 3 times on the way to the hospital and was in a coma for a month. Wouldn't have changed the current situation much, but knowing she was sensitive to head trauma would have had me on my toes for sure. Story 34. I had a large inguinal hernia as a kid. I was too embarrassed to tell anyone that one side of my ballsack was very large, walked around like that for weeks. Finally decided to tell my mom, the RN, about it, and had to drop my pants for her to inspect. She calls in my aunt, the doctor, from the other room to give her opinion. All of this is taking place at my grandfather's house. The exam took place on the staircase. I had surgery soon after that, and then another surgery when I was still having pain. A nerve got caught in the scar tissue, then had to have a third surgery sometime later because I was still complaining of pain, so they went in for exploratory surgery. Story 35. I'm not a doctor, but a mom. My son didn't grow from 6 months old to a year and a half, and we didn't really notice because his pediatrician just shrugged it off. He also had a huge belly that was super hard. We just thought he was chubby, so we never said much. Turns out his liver was more than double normal size. We felt like his health was weird, and we got shrugged off by the doc, so we never brought it up again. Trust your instincts. Story 36. I'm not a doctor, but I can tell a story as a patient. Ever since I can remember, I had a purple fingernail. Not like blood under the nail, but the fingernail actually grew purple. Happened after an injury when I was a little kid. I had doctors look at it all my life. They all said it was weird and that they couldn't really explain it, but that it wasn't an issue. When I was 19 years old and getting a physical before college, I went to a new doctor in the city I was moving to, and she pointed it out. I said something like, "Oh, I've had that since I was a kid." Other doctors never could figure out why it grows that color. I could tell she was actually concerned. She referred me to a dermatologist, and sure enough, they said it was quite fishy. Could have been an indication for some kind of, and forgive me, I'm not a doctor, but some kind of melanoma or skin cancer. They took a biopsy. Turned out to look sketchy. They sent me to a skin cancer specialist. Their results came back extremely abnormal, but not cancer. They ended up amputating purple part of my finger, and it all turned out fine. I don't know exactly how this stuff works, but I'm so glad she caught it. Now you can catch me in the dermatologist office every 6 months getting checked for irregular pigments. By the way, their theory was that it was a mole that got crushed and the pigment got spread throughout my finger or something like that. Edit. Wording. Story 37. A few months ago, a woman, 36 consulted to endocrinology because she was getting fat without a change in her diet, and she felt different. Asking more questions, she casually mentioned she hadn't had her menstruation for months and that maybe she was menopausic. At 36, we suggested that she might be pregnant, and she said it was a stupid idea and that she knew she was not pregnant. We did some analysis and an echography, and yep, 35 weeks pregnant. You give birth at around 40. Story 38. As a kid, I was always out of breath and could hardly do any physical activity. When I would run or laugh hard or go up the stairs, my legs, arms, and trunk would tingle. Thought I mentioned that to my parents a few times, but at the doctor, all that was ever said was I wasn't very active. Ended up passing out in gym class at age 8 and being diagnosed with a cardiovascular problem about a month before it would have killed me. The tingling and dizziness should have been a good clue. Story 39. Not a doctor, but the first family doctor I went to for depression didn't think I had PPD. It goes away after 6 months, and wanted to wait for a professional's diagnosis. 2 weeks later, by chance, I saw the other doctor in the office. He asked if I was having suicidal thoughts, and I told him that whenever I was alone in the car, I was working again and regularly used the highway, I wanted to drive into a wall. Oh, and searched for the nearest bridges, just in case. Apparently, this is an emergency, and he hooked me up with antidepressants that day. I'm doing better. Story 40. Not a doctor, but was told by doctors. I should have mentioned that I had been unable to breathe while laying horizontally at home after my C-section and had been sleeping in an upright position. This was after I went into the hospital, a week after my second was born due to high fever and a blood clot. Didn't think it was a symptom that needed mentioning, but apparently it was important. Story 41. Obligatory, not a doctor, but my mom just told me this one. She was talking to a patient, she's an ophthalmologist, so she was going through the normal questioning. The patient has some weird abnormal growth on the neck. Mom. So you're diabetic? Patient. Yes. Mom. High blood pressure? Patient. Yes. Mom. Say, what are those growths on your neck? Patient. Oh, it's just a mild dysfunction of my thyroid. Story 42. Nurse here. Had a man come in complaining of urinary retention, which could be because of his age. He left out the weakness and numbness in his legs that had been going on for almost a month during all of his assessments. These assessments were by both doctors, urologists, and nurses. He always denied any other symptoms besides urinary retention. He suddenly stopped being able to feel or move below his belly button. MRI of his back showed cancer into his spinal column, and he died 8 months later. Story 43. I'm an emergency medicine physician. I had an elderly gentleman come in because he fell in his kitchen. Didn't lose consciousness or anything. Didn't have any signs of trauma. But both eyes were slightly swollen, which he said happened before the fall. Oh, and he forgot to tell me, he also had a sore throat. He wouldn't have even brought it up if I hadn't asked why his voice sounded a little muffled. Took a close look at his throat. He had some pretty significant pharyngeal edema. He ended up having what's called angioedema, which explains the throat and eye swelling, different from an allergic reaction. He ended up getting intubated and sedated, and went to the ICU to protect his airway. He initially came in because of a completely inconsequential fall, and got intubated and admitted to the ICU because of an "oh, by the way, doc" moment. Story 44. I had a patient come in with a neck mass. There was enough off that he got the beginnings of a malignancy and infection workup that was remarkable for the mass being a hematoma. Then he remembered he was in a car accident and the seatbelt was where said mass was. Story 45. Not a doctor. I was in a garage band and my audiologist thought I had conductive hearing loss. Got a CT scan after it continued getting worse, and turns out it was cholesteatoma, which had dissolved my hearing bones and was eating through my skull towards my brain. Had to saw open my head to completely remove the material from the middle ear. Story 46. Legit, just ask another doctor. They're notoriously bad as patient themselves and love to downplay their own symptoms as being more mild than they actually are. Source. Wife is physician. Hear it from her all the time about other docs, and I've witnessed on multiple occasions her do it too. Story 47. I was discharging an elderly man in a wheelchair who had been treated for an urinary tract infection. At the end of the conversation, I suddenly realized, somewhat embarrassingly, that nothing in his papers told me why he was in a wheelchair. So I asked, "Why are you in a wheelchair?" "Because I can't walk," he answered. "Well, fine, but why can't you walk?" "I don't know." "Okay. How long have you been in a wheelchair?" "Since I was admitted last Sunday." "Okay." At some point, everybody in health experiences how difficult it can be to get information from patients. A good tip is to ask specific questions, so I followed up with, "Did you have any problems walking a month ago?" "Oh no, no problems. I went for daily walks." At this point, I actually had to get up and do a neurological exam and found almost totally loss of motoric and sensoric function in the lower extremities. Turns out he had a metastatic cancer compressing his spinal cord, and since he hadn't mentioned his quickly deteriorating legs, he had just been put in a wheelchair at admission with no further questions asked. Story 48. Not so much a symptom, but a medication missing from their health records that produce symptoms of poor bone grafting. In my dental office, and basically any dental office, we ask you to fill out a health history form and sign it. We will again ask you at X-rays about any medications or health concerns. We will again ask you about what medications you are taking before any procedures. We will ask you again each and every time you visit the office, even if we just saw you yesterday as your last appointment. This man came in for several implants. This has multiple stages, which means multiple visits. We ask countless times upon each visit about his health records, health history, and medications. Nothing. Okay, that's great. But guess who had many failed implants, pain, and bone issues develop? Every implant's failed. We only found out what the heck was going on when we scratched our heads trying to understand why a or healthy Saturn person was having bone problems and asked him if it was fine for us to contact his physician. And from his physician, we found out about his medication and made the connections right away. The medication he was on greatly prevents proper bone health. We would have changed our entire treatment plan if he had mentioned his medication he was taking. We even explained the treatment plan several times and asked if there were health problems so many times, and he stated no health problems. At least if he had stated a health problem, we could have researched what medications are used for it and prevented issues. He required bone grafting, and proper bone health is imperative. He spent thousands and then blamed us. He is forcing our doctor to do thousands of free work on damages because of his mistake. So much money, pain, and problems could have been prevented if this man just told us what pill he fed himself each night before bed. Story 49 patient here. But what about when you are admitting yourself to urgent care or ER, and you are telling the staff there everything, the absolute truth, and they treat you like you are lying? Last time I went in, I was in severe abdominal and back pain. I knew it was something kidney-related because I had had a kidney stone before, but this one was worse. I was now vomiting, unable to stand up. I'm literally collapsing out of the wheelchair onto the floor while giving the desk lady my info. I swear, she showed no concern. I think she thought I was being dramatic. I was saying, "It's my kidneys. I know it. Please. It hurts." If the place was busy, I would have understood her dismissiveness, but it wasn't. The nurses were so lackadaisical and even snarky. The first painkiller they gave me didn't work, so I immediately asked for a second, and that just set them off more. Turns out it was a kidney infection, and I was a step away from kidney failure and had to get a stent put in. But seriously, what's with the attitude? Was the vomiting and collapsing not proof enough that I was being honest?